Hello, I'm Rosa Gonzalez-Guarda. I am an associate professor at Duke University School of Nursing, and I am also the faculty lead at the Center for Nursing Research in the area of population health. Recently, I also became the co-director of the Community Engagement Core for our Clinical Science Translational Institute. So at the Center for Nursing Research, we have 4 areas that we call research areas of excellence, which are areas that the faculty identified as strategic priorities for the school. And one of them is the population health research area of excellence, which is the area that I lead. Through that area of research excellence, we partner with the D-CHIPP program to really support community academic partnerships. Through the work of the Center for Nursing Research and the D-CHIPP program, we work together to support faculty that are engaged with community partners, conducting research that have the potential to advance health. And just to give a few examples of some of the partnerships that we support and some of the activities that we engage in, first, I'll talk about a project between 2 faculty members, Dr. McConnell and Corazzini, and a local community organization which is called Dementia Inclusive Durham. And we have worked with those 2 groups to convene diverse stakeholders at meetings to share ideas that they have for research. We think about bringing together people that are typically not talking to one another to talk about potential areas for research. Another example is the work of Dr. Randolph and her interventions with barbers and barbershops. And the Center for Nursing Research and the D-CHIPP program is working with Dr. Randolph to try to find ways that she can support financially the community partners that she's working with for her research. And then finally, another example is a faculty member, Dr. Simmons, who is working on a technology-based intervention to help manage weight among pregnant women. She's partnering with the Population Health Research Area of Excellence and the D-CHIPP program to find ways to engage the local Latino community in that. We see research as a very valuable tool to learn about community and population health and learn ways to improve outcomes in the community. And as the name D-CHIPP implies, the P in that, the partnership part, is very important to us. So we see the partnership really adding to the value and the rigor of the research, as well as developing the trust and the relationships that are needed, not only to produce the type of improvements in community health that we're hoping for, but also to make sure that those relationships are more equitable and consequently creates healthier communities. We have a R01, which is an NIH award, where we're partnering with a community organization that has been a leader in addressing Latino and immigrant health issues and social issues affecting that community. And in our research grant, what we're hoping to do is to better understand the impact that acculturation stress and resilience has on multiple health outcomes among Latino immigrants in the Durham area. And so as part of the partnership, we have the director of El Centro Hispano that's a co-investigator on our study. And then we also have staff of El Centro Hispano that have become researchers on the team and are really leading the engagement components and recruitment and screening components of the grant. So when we kicked off our grant, we had a meeting where we brought all the folks, all the collaborators together, and this included folks that are typically working on the bench. We have a biomarker component to our study, so we had a bench scientist that participated in the meeting, and then we had community members and leaders in the community, in the Latino immigrant community that participated in the meeting. One of the things that our community partners asked us for is if we could take advantage of the time that we were using to train our research staff to also train staff at the community health organization at El Centro that do health promotion work. So we had an opportunity to also do some training with the promotoras, the lay health workers in the community.